So this was 2015. Video shows UHS hospital staff assaulting young patients. I forget where this was at because there's a chain of them. Acadia and UHS have mass amounts of hospitals. They do not care. They only care about this. This is all they care about, is their numbers on the stock market. The administration is the most horrible, horrible people. Horrible people. And it's been going on forever. And I've said for a long time, these people need to go to jail. At some point, no longer can they have they're in the billions, these CEOs and these administrators. I'd like to lobby to Donald Trump that these people go to jail so it stops, so that patients can be helped again. Not beat up, not staff beat up. This is the ongoing, and they get away with it, yet they have cameras everywhere, everywhere, everywhere. Like there's nowhere you can be that there's not a camera on you, except in a patient's room. And so they see people getting punched, getting beat up, getting their teeth knocked out. Staff, where I work, and nothing is done about it. What they want to do is give patients now a 15 ratio. 15 patients to one nurse. It's already bad with 12. That's how important this is to them. So those people that do that, those chief nursing officers, they should face jail time. Because they don't know how to do the right thing. And I've been saying that COVID was going to create a bunch of more mental health crises. So it was the perfect opportunity for your UHSs and Acadia to then create a bunch of hospitals. Yes, because they can get the winnings coming in, all the money. But they don't care. People are not being helped. Acadia Healthcare is one of America's largest chains of psychiatric hospitals. Since the pandemic exacerbated national mental health crisis, the company's revenue has soared. Its stock price has more than doubled. UHS Acadia Healthcare navigates scrutiny amid safety concern allegations at psychiatric hospitals operating as nonprofits. That was just July of this year. And you see here, in a post on X, Tara Banow from Stat News said people who worked at Acadia and UHS hospitals across the country from one another said the exact same thing. There was systemic understaffing and undertraining, and our pleas to corporate were ignored. 100% true, and has gone on for decades. So that is how you result in patients hanging themselves, because you have to have staff. I don't care what AI you have. Okay? But all these people care about is money. When you have this sick, twisted of administrators, something must be done to stop and combat this problem, because they are responsible for people's being assaulted, people being hurt, and they get away with it. That's why they keep doing it. So until there is jail time placed on these people, it will not stop, because they do not have any conscience. This kid that you see here with that, he had a broken leg, and the nurse told him not to shower, not to get the cast wet, but the hall monitor told him, no, you're going to take a shower. Took him in his room, and then when the cameras picked him back up coming out, he was all bloody. So then the kid picked up his crutches to hit him with it, and then him and some other staff took him back in his room, and then it was a while before he came back out. And when he came back out, they wanted to crush his broken leg. This is, so they can blame the staff. I'm not trying to say there's no blame on staff here, but they put these people in on purpose. Please understand me, they do. That's how much I've been saying for years now, these people that are running our healthcare system, most especially your freestanding psych hospitals, I'm not talking about the doctors, the people running it, your HR, your people in the top administrations, they just fly under the radar. Nobody ever does anything. So it's no skin off of their teeth when a patient or staff is abused or punched or hit or attacked, spit on, whatever, bitten. This has gone on for decades and decades. They are responsible for so many assaults, yet nobody goes after them. That's what needs to happen. That's the only way you can stop it. This poor kid was there to get treatment, and he was beat the hell out of. Why would somebody even be there that's like that? I've never known somebody that is a hall monitor to force somebody, but this was all on camera. And that's what makes it worse, is because the administrators see it on camera. There's a reason they put all those cameras in. They want to see you get hurt. That's how sick they are. They do. They want to see disasters happen. That's why these people are psychopaths that need to be locked up for the amount of because at this point it's a crime. How many times does a patient have to hang themselves? How many times does a patient have to be abused in one of their hospitals? How many times does staff for decades and decades and decades have to say, no, they will not give us, if anything, they're taking more staff away. They are deliberately trying to get nurses and staff and patients hurt. Those kinds of people are a danger to society.